sometimes. So I had this big meeting in May, and I had 3 of my speakers who videoed in to present to the group. And I thought I had clicked on recording, but I guess I didn't click the final button. And so only 1 out of the 3 did I get recorded. So anyway, okay, it's 6:30, so we'll get started. I think some of you have been with us before when we've had Debbie Ozment here. I'm trying to think how we got, I think we got connected through Dr. Davis originally. And, you know, I was just so impressed with Debbie's knowledge of the gut and the mouth and the microbiome and how all the pieces fit together. And I've become a super fan of her podcast, Vitality Made Simple, which, you know, she has some of the most interesting people that I have learned things I didn't know from. And then if you haven't been following her on Instagram, she has, I think, some of the funnest short clips that I really enjoy, her tips and tricks that she presents every day. And, you know, she's just fun and happy and full of light. And that's one of the things I love about her. So welcome tonight to the group, Dr. Debbie Ozment. Oh, you're on mute. Did you mute yourself? We had your sound a minute ago. What happened to you? It doesn't show that you're muted. We need Mike for technical support. Can you hear me? Okay. Nope. Okay. Wait, I thought I heard something there for a sec. Oh, no. I have had sometimes, if you have a new iPhone, my iPhone stole my sound one time and I had to actually turn my phone off. It says to unmute me. You're oh, now see if you can unmute yourself now. No, do you want to go out and come back in and see if that works? Okay. That's weird. Well, here you are with me again.
Martha, can I ask you a question real quick about my brother?
Sure.
So he's doing the sugar shift. I just gave it to him Sunday. Oh, she's back on.
Is it working, Debbie? No.
You could see her mute is off. You see that on the screen on the top?
Now hit your mute button. It does show that you're muted. Now say something. No. That's really strange because I could hear you when you first got on. So it doesn't make.
I wonder if she needs to give special permission, like literally in her computer to have permission to use the microphone. I know my Mac asks periodically.
Yeah, I'm usually asked when I log in if it's okay to use. Let's see. You can call on your phone for the audio, Debbie, if we can't get it working. Debbie Burnish, you want to ask your question while she's trying to figure that out?
Oh yeah, and so I gave my brother the sugar shift yesterday. Should he be starting with 2 a day versus 1 a day? Because he's got Guillain-Barré syndrome, or just do 1 and see what happens.
Is he sensitive?
He's just got a whole bunch of crap going on, you know, because are you familiar with that syndrome? It's just weird.
Yeah. I think he could probably try 2 a day.
Okay.
I
So
would
right
just, have him pay attention to how he's feeling. And
Mhm.
yeah.
Yeah, well, I've got him on just 1 a day, but I thought before I told him to increase, I'd pass it by you first. So, anyway, okay, thanks, bye.
Well, while we're waiting for Debbie to get her technical support, anybody else have a quick question you want to get answered?
Yeah, Martha, this is
Yeah.
Rita.
Hi,
I
Rita.
was just, hi, I was just out in my beautiful forest and it started raining.
Oh,
I have repairmen inside my house. Anyway, I'm in my gym now. But remember we talked about the EGFR, the kidney and sugar shift? Because it turns to mannitol?
yes.
Okay, so I did research it. If you do have CKD, you can't take sugar shift. Now look up sugar shift and EGFR and it'll come up. And they explain to you the mannitol.
Interesting. Okay.
The mannitol cannot, it puts, cannot be filtered through the kidneys. So, I'm just a stickler about EGFRs because the ALS people, and theirs tend to be higher. It's like a false reading.
Interesting.
Isn't that interesting? And the
So
only reason I would even know about mannitol is my best friend, who is a functional medicine doctor. She won't call herself a nephrologist. She calls herself a renologist. And she wrote, I have a book that is thick, and she wrote about mannitol.
I don't know.
Oh, I can hear you now, Debbie.
Okay. It had jumped
Okay.
over to my phone for some reason.
Yeah, that happened to me once before, and I had to turn my phone off.
Yeah.
I'll
okay.
follow up with you separately on that, Rita, because I think I have something on glomerular filtration rate that I can.
Okay, no problem.
Okay. Welcome, Debbie.
Thank you.
Okay, now I'm going to pin you to the screen. So there you go.
Well, that just got my heart rate up because I had to run down the stairs. We have our whole kitchen's full of furniture. We have lived in our house almost 30 years, have had this same carpet for 30 years, and it wasn't that bad, but we're having it ripped up, having this, wood floor put down. So I did an obstacle course, you guys, to go out and get Mike out of the garden. I pulled him out and was like, help. So anyway, I'm all charged up now. Well, here we go.
Well, we're glad to have you back.
Well, thank you. And I'm
Take
sorry.
a deep breath.
It's probably something I did. And, I don't know what I did, but thank you very much. Thank you for the honor of being here. I know when I met Martha, I was so impressed because she was the first person that I ever knew who had a true consortium in her probiotics. And that just makes so much sense because, we are not just one thing. And as you all know, the modern medical establishment tries to make it all one thing. Oh, one thing, one secret berry from the Amazon, and you're going to feel great. One secret financial from some guru, and you're going to be a jillionaire. Everything's one thing, right? No, our bodies we're body, soul, and spirit, and we're many, many things. And so thank you, Martha, for that. It's just been a joy to know you in so many facets. We've been at conferences together, and she's actually been to Oklahoma City. So we've had I feel like a real wonderful relationship. So it's a joy to be here. I want to talk to you all tonight just about the rainforest that is the oral microbiome. And once again, so often we try to reduce that to one key bacteria or a few, but indeed it's how they all work together that make the difference. My world changed in 2010 when I attended a vascular inflammation seminar given by some cardiologists, and I almost didn't go because it was in Las Vegas, and I hate Las Vegas. And but I was like, okay, I want to go to this vascular inflammation class. Literally changed my whole paradigm. I think there's so many things I'm not good at, but one thing is that I'm very, very observant when it comes to people. I'm not observant about street signs, and I get lost constantly. But when it comes to people, I noticed everything. I had this wonderful little boutique practice where I knew my patients, I knew their dog's name, I knew their favorite color, I knew everything about them. And I started noticing that their drug lists were getting longer and longer, but yet they were getting sicker and sicker. Now, I went to dental school in the early 80s. I graduated in 1985. I've been a dentist 40 years, and we are very much trained as carpenters. We are trained to write prescriptions when people want prescriptions and to fix teeth. You all have probably heard me say, my daughter, when asked in kindergarten what her mama did, she said, well, my mama is a laundry lady and she fixes teeth. And, you know, that's exactly it. I'm very much a carpenter. I can fix things. I can open pickle jars because I have very strong hands. And, but I started noticing these trends of people, you know, as I said, getting sicker and sicker. And I started noticing that the people who didn't take as good of care of their mouth, or who had more root canals, or who had more dental work, generally more construction in their mouth, were sicker. And so that's what propelled me to this this cardiology conference. Actually, it was on heart attack and stroke prevention. So at that conference, they launched a new oral DNA test whereby we could, with a simple saliva test, determine what bacteria were in the mouth. So consider that this is 2010. Now, you know, a lot has happened in the last 10 years about the oral and gut microbiome, especially the gut. The oral, you know, we're just sort of, you know, beginning here with the oral microbiome. But it really changed. I came back and I tested anybody who would spit for me, you know, and just started gathering information, have done hundreds and hundreds of these tests. Interestingly, I tested, of course, my husband, Mike, at the time our children were both teenagers, tested them, tested my little office team, and then a ton of patients. But I came back with a very bad bacteria called Treponema denicola, and started researching this bacteria, found that it's a spirochete. Well, a spirochete is in the same family as syphilis. It's a corkscrew shaped configuration. This bacteria can burrow into all kinds of areas. It's not syphilis, and it's not a sexually transmitted disease, but it's like at a family reunion when you look alike. You know, you may have very different personalities, but you still kind of look alike. Well, that's how Treponema denicola is in terms of its virulence in the body. So I started researching this, found that it is transmissible, transkissable. It has an affinity for the blood-brain barrier, causes a lot of neurological problems, and typically is found in a failing root canal. Now, so if this is the gauge, I had about this much, and my husband, Mike, had about this much. I had one root canal in my mouth that looked fine on x-ray, felt fine, absolutely zero problem. He had no root canals. So as an experiment, I decided to get my tooth out and see if that would cause this weird bacteria that we didn't know much about yet to go away. Went to my front desk person, who was also named Debbie. We'd gone to grade school together and been in brownies together. So I said, I'm going to cancel me on this day. I'm going to go get my root canal tooth out. And she's like, you are losing it. You've gone a little too far. You're telling people to go get probiotics when you write antibiotic prescriptions. You're not using fluoride anymore. I'm worried about you. And now you're going to go get a tooth out. So anyway, I did anyway. And then retested 3 months later. And for sure, that bacteria was 100% gone in me and 100% gone in Mike. Now, whenever they took my root canal tooth out, the oral surgeon, who was also a friend of mine, said, there's nothing wrong with that tooth, Debbie. There's nothing wrong. And I was like, we'll see. right? We'll see. But the DNA didn't lie. And I've never, ever regretted having that tooth out. So that was another thing that really propelled me into this journey of re-education. I, at that point, went through the A4M fellowship, and then as an oddball dentist in Oklahoma, where the 60s got to us in the 70s, I decided that I for sure better get the most education I had. I went ahead and went through the master's program that's part of a medical school curriculum for metabolic nutrition. So, sort of, and once you start, you all know, I see a lot of your familiar faces, once you start learning, you can't stop learning, because this is everything. This is life. Vitality. If you don't feel good, what's the point? And the point's health span, right? Martha and I have talked a lot about this. We don't know if we have a lot of control over our lifespan, but we do know that we have a lot of control over our health span, the number of healthy years that we get to enjoy. And that's what was so compelling about Martha's story with John. She was dedicated to improving his health span, and she did. And so, that's all we have. I mean, we're not going to cheat death. We're all passing through. We're all a vapor. We're all a mist, but we want to feel good while we're here. So what is happening in your mouth is not about your teeth initially. Once your teeth get loose, once you get those Billy Bob teeth, as I call them here, where they just look like they're all crawling all over each other, their body's long gone. I mean, we so often go to the dentist and it's like, oh, your teeth look fine. Well, yes, your teeth look fine. You can ignore your teeth pretty much and still take them to glory. I have a skull. I should have gotten it out. I had a skull that I had to buy in 1991 for anatomy. And this old boy, his teeth are hanging on by a thread. And, but who knows? He was probably 32 when he died in metabolic reasons. But so please know that anything we talk about tonight, I'm going to be looking at this from a systemic point of view, because we know that health starts in the gut, right? Raise your hand if health starts in the gut. But the truth is, the gut starts in the mouth. It is one long tube, stem to stern, north to south, pie hole to, what, and it all starts in the mouth. It's north, headed south. So we so easily forget that that we have to balance our oral microbiome. This reminds me just of the point of mouthwashes. And I know I'm singing to the choir. And because you all are so astute, we were, again, taught to use these heavy-duty antimicrobial mouthwashes like they were water. I'll bet I swished with Listerine no less than 10 times a day, every day. Go in the room, didn't want to have bad breath, spit in the sink and going in and, ask about their vacation. And so it, that's just one of the worst things in the world that we can do, because we know there's 700 species of bacteria in the mouth. We've cataloged about 53% of those, I think we've cataloged 57% now. About 13%, we kind of know what they are, but they're not named. And then the other 30%, if I did my math right, are totally, we don't know what they are. But what we are learning, as in the gut, is that they all matter in some way or another. The good bacteria so often get lost in the crowd when we deal with the bad bacteria. So we want to learn to balance the oral microbiome. So Martha, jump in. I'm just rattling here.
Well, the mouthwash thing is, and toothpaste actually is interesting to me, because I've actually become aware. Well, I mean, so I'm working on a paper with Dr. Barry Ninham, who is he's a scientist from Australia, And he's a colloid chemist and like all these different areas. But one of the areas he was researching back in the 1980s was something called these quaternary ammonium compounds, which are surfactants that go in cleaning things, but they also go, I was shocked to find out in the last 3 or 4 weeks that they're in toothpaste and mouthwash. And they're really damaging to something called the glycocalyx, which is basically what surrounds all the membranes in our body. And so, like, well, first of all, you're killing all those bacteria in the mouth, but what are you doing to all these really important surfaces that is where our immune system is communicating? So, you know, I don't know how much you know about the glycocalyx, but, you know, these compounds that are in the toothpaste, and I think we talked about this one of the times before, like, you know, what do you look for in a toothpaste? Is, you know, I know some people who use baking soda, you know, that's going to change the pH of your mouth. So, like, what do you recommend for people in taking care of their teeth daily?
In my mind, and what I've seen in decades, is that less is more. So you want to find a toothpaste, of course, that does not have fluoride. Also, you want to avoid sodium lauryl sulfate. You'll see that as SLS, which is a foaming agent. I really think the fewer the ingredients, the better. And some of these homemade toothpaste are excellent. I mean, you can easily buy pH strips to know, you know, if your pH is staying in a good, just barely basic range. You can also buy nitric oxide strips. I had Dr. Nathan Bryan on the podcast a couple months ago. We talked about nitric oxide. And so you can find out if the good bacteria are actually thriving to produce, say, you know, nitric oxide, or to keep the, you know, the proper pH helps the good bacteria thrive. It's so interesting, Martha, as you were talking about the glycocalyx. As soon as I get off this call, I'll probably be researching to see if Fusobacterium nucleatum has been tested in terms of how it affects the glycocalyx. Fusobacterium nucleatum is an oral bacteria. It's called a commensal. So it's a bacteria that at low levels, it's actually a beneficial bacteria. It's when it overgrows that it becomes very, very dangerous, much like your mother-in-law. You know, I'm a mother-in-law. And if I stay too long and give a little unsolicited advice, oh, are you aware? Then, you know, I become Fusobacterium nucleatum. I become very, very dangerous, and they're ready to get rid of me. And so that's how this oral bacteria is. It overgrows. Some things that make it overgrow are the typical things you would think. Things, you know, processed food, sugar, stress, dry mouth, pharmaceuticals that make the mouth more dry. Those are all common things that increase the bacteria that happen to increase type 2 diabetes. You know, all of these things that change the oral microbiome are bidirectional in terms of these systemic diseases. So I'll look that up. That'll be really interesting to see, because I would suspect that we can find a good paper or papers somewhere talking about Fusobacterium. The reason I kind of land on that one is because it's really a hot topic in the research right now. Whenever I started testing in 2010, we saw Fuso in there, and it didn't do a lot of damage in the mouth, so we didn't think it really mattered. We only looked at those more aggressive, high risk oral bacteria like you hear about a lot, the Treponema dinicola that I mentioned, and then Porphyromonas gingivalis, which is so implicated in neuroinflammatory diseases. Martha and I have talked a lot about that. Parkinson's disease, Alzheimer's disease. Dr. Dale Bredesen was on the podcast a couple of months ago, and we talked about Porphyromonas gingivalis, but we also talked about Fuso because it's the new hot topic in memory. And then there's one called Tannerella forsythia. So those are the only three that we worried too much about. But now we know that Fusobacterium nucleatum, while it might not do a lot of damage directly in the mouth, it does a lot of damage systemically, and it sort of, starts the gang war. It gets other bacteria stirred up. It's a building, a bridge builder. So it makes biofilms form more easily. So I could think, Martha, since it does induce more biofilm formation and make the biofilm stronger, that it does impact the glycocalyx, that thin layer of cells that are essential for vascular health. One interesting thing lately in my research is that Fusobacterium nucleatum is just deadly for natural killer cells. So natural killer cells in our gut, are essential to fight cancer. It's part of our immune system, our immune cells. Natural killer cells are a subset. And Fusobacterium, there's fantastic research. I think I have it on my website I have a free research tab, quite a bit of information about natural killer cells, because I think if you, for you all who are so interested in health span, to just think, okay, how's this going to impact my natural killer cells? That would be a pretty good place to start, in terms of a decision tree for what you want to do. Of course, these bacteria, Martha, that you have in your consortiums, they are all boosting the immune system, and so they're helping to enhance natural killer cell strength.
So, and I think, if I'm remembering correctly, I've read so many papers on the microbiome, but I think Fusobacteria is also associated with colon cancer, isn't it? Isn't that the one?
Yes, thank you for bringing that up. In fact, it's considered to be causal for colorectal cancer, which, if I said causal on, tonight on this, and I was wrong, you might just see me drop dead because somebody would shoot me from some, space station or something, because we can't say causal. In the world of medicine, we can say it's associated with, with it impacts or whatever, but causal's a big deal. After I did my TED Talk in 2019, I got this long email from this German researcher who sent me all of his newest research about Fusobacterium nucleatum. And he said, in your TED Talk, you said that it's related to colorectal cancer. It's causal, and within 5 years, you're going to believe me. And I absolutely do. Now, what we do know is that there's a subspecies. We've Fusobacterium, genus, species, nucleatum, and now we know there's a subspecies called Animalius. And this is really very new research. And that it's that subspecies that we believe is really the culprit in being causal for colorectal cancer. But the DNA of this bacteria is found in upwards of 50% of colorectal tumors. Not only does it's one of the instigators. Of course, again, there's more than one thing. The terrain has to be kind of ripe for it, but it also makes the cancer grow. An interesting case I had a few years ago, before we knew about Animalius, this is the Animalius subspecies, is very new, yeah. But in all reality, folks, does that matter? I mean, if you have Fusobacterium nucleatum, you need to get rid of it. It doesn't really matter if if you know specifically about the subspecies. But anyway, I had this man come in who had had his intestine had a resection, a colonic resection. He was wearing a external bag. His tumor was growing. He had a pump that was putting 5-fluorouracil into his gut every day, and his tumors were still growing. So I did, so this is probably 3 or 4 years ago. So I did oral DNA testing, found that his fuso was high in his mouth, did stool testing, found that his Fusobacterium in his gut, which we don't even have a species there, we just have the genus, was to the 6th power. Now, I use the GI map, and I don't agree with some of the reference ranges. Their reference range for Fusobacterium is too high. I see problems at the 6th power consistently, the 6th power. And so anyway, his Fusobacterium was at the 6th power. I did a deep cleaning on his teeth and put him on 10 days of metronidazole, which is Flagyl, and 500 milligrams twice a day. So, and then taught him my oral hygiene routine, which is very simple. Anyway, his wife called me, she just texted me, call me, Debbie. She said that Stevenson Cancer Institute said his tumors in his gut were almost gone. They had started shrinking. So, here and she's like, it's something. What do you think it is? And I said, well, I don't know yet. Let me try to figure it out. So I start researching it. Well, come to find out, new research had just come out that Fusobacterium can cause these cancer cells to be resistant to some types of chemotherapy. At that time, they had determined that Fusobacterium caused cancer cells, including breast cancer cells, to be resistant to 5-fluorouracil. Well, now now we know it also causes resistance to oxyplatin, cisplatin. So, the search is on. I think you could assume that if it's high, why not? Why not? Yeah.
So can we go back to the toothpaste for a moment? Because I had someone who they wanted a specific recommendation, and I have a couple of questions myself. So I mentioned that sometimes I use baking soda, and when I use baking soda, my teeth feel just super clean, like the cleanest of all. I have tried a powder that's like a mineral powder. I want to say it might be from Redmond Salt. It's called Earth Paste. But what I found with that is I found like I was getting mineral deposits on my teeth from the powdered stuff. And then I use Himalaya, which I think is a brand that I had talked to you about before. Yeah. So I'm just curious, do you have, and I know definitely you don't want to use Colgate or Procrest because both of those have the quaternary ammonium compounds in it. But maybe you could just speak to that for a bit, and then we have a question from Sharon after you answer that.
Yeah, I think toothpaste is overrated. So I use Himalayan still. I'm trying one that Debbie and I are checking out. Debbie Burnish that's on. But the jury's still out on that because it's an expensive toothpaste. Himalayan is readily accessible at, everywhere. It's $8 a tube. It's pretty, it tastes pretty good. I don't think toothpaste is as important as we think it is in terms of benefit. I think the more caustic things that are in toothpaste that people can swallow are bad, like fluoride. Let's see, I can't think of the woman's name who was on my podcast who talked about fluoride. I mean, it was a great interview. I'll think of her name in a minute. But if I could divert a little bit, I got out just to tell you all, if you're interested in some simple things that I recommend that really, really work. I mean, I recommend that people brush their teeth. I can't tell you, I would tell you to floss because that's, how I was raised in dental school. But what really works for people well are these little brushes that help you get between your teeth. The biofilm lives between your teeth where your toothbrush can't get it. So think about if this is, 2 teeth, the biofilm is right here. And on the outside, there's like a pocket in there. And so you need to get down there and scrub that every day to keep that biofilm disrupted. So it's really more mechanical than it is chemical in terms of keeping that healthy, which is another, a good thing in terms of not disrupting, not changing the chemical compound of your mouth. So there's other kinds of brushes. These are plastic. They're at Costco, and now they're mint flavored. I'm like, oh my gosh, I wonder if I need to call the company if they would even talk to me. But I've sold hundreds and thousands of packages of these for them, just because I say go to Costco and get them because they work. Some people use a toothpick, and that's a great mode. Everybody's not as dexterous with a toothpick. These little, doohickeys are pretty foolproof. You can't hurt yourself. You can't get splinters.
Have you ever seen this one? Do you know
Yeah.
this?
Yes, I used to recommend that one, Martha. I like those doctor's brush picks. Those are actually the first ones I recommended, and they're great. They just bend a little bit on people.
They're not super sturdy, but I actually found those through one of John's fishing buddies who always has one in his mouth. And I was like, what, we were at his house visiting and I tried it and I was like, ooh, I like that. It really gets into those little spots.
It really does. No, those are great. And we used to bag those up. We'd sit around at the office, when we were all just talking. If we didn't have a patient there, we'd bag up those little doctor's brush picks. The reason I started using some type of brush pick was based on a trip to Nicaragua, a medical mission trip. And on those mission trips, you're just taking teeth out. You always have people who have a rag on their mouth and they're just in pain. Well, once in a while, I'd see somebody who just had these gorgeous teeth. We were in the middle of, sugarcane country. So most people had teeth broken off at the gums from decay. But I'd see somebody who had these beautiful teeth. And typically what they were doing is getting a little twig off of a tree and like peeling that twig and then using that to clean between their teeth. Same action that these little brush picks do, breaking up the biofilm. They didn't know what they're doing, but it was really working. So hopefully I've made the whole toothpaste thing clear as mud, because you can spend $30 a tube on toothpaste. That's okay. If you like it and it tastes good to you, it doesn't have fluoride and it doesn't have, any of those bad compounds, go for it. I've tried almost every brand. Some are too slimy for me. And, I just happen to like Himalayan and it's very accessible, and I'm trying some new ones. But one thing I've found with my patients, since we do this saliva testing and we can have before and after results, and incidentally, since my patients are typically physician referrals, they come in with a lot of blood tests. They come in with a C-reactive protein. They come in with a, hemoglobin A1C. We get to really see if what they're doing, if what I'm helping them do is moving the needle for their health. So that's what's so fun about my job, because we really get to do an experiment on everybody. So through all of this and trying to figure out, well, how in the heck do we control that pesky Fusobacterium? How do we tame that mother-in-law? So I came across some fantastic research on black seed oil, Nigella sativa. And, black seed oil, the active ingredient is thymoquinone. And thymoquinone has been studied extensively in the research. Another thing that's really a hot topic. So I'll get on something like this. And now I have, 4 4-inch notebooks of research on all kinds of areas related to black seed oil. It's very specifically effective against Fusobacterium in most people. Of course, nothing works for everybody. As I said earlier, there's not one thing that's going to be the answer for every single person. But when I started using black seed oil about 2 years ago, I would tell people to oil pull. Well, I like to oil pull because I like to walk around, I walk around, brush my teeth. I walk around, but everybody doesn't like to oil pull. It's kind of a tough thing for people to sustain. And, but I was having them use a little bit of coconut oil and a few drops of Nigella sativa, of black seed oil. So I bottle it up for people and put a label on it, but you kind of need a dropper bottle if you're going to use it for anything dental. And people would be like, oh, I love this. Oh, wait, I've been forgetting to use my black seed oil. So my husband, Mike, that you saw, who's been out in the garden, he takes forever to get ready for bed. I say, he's like, I'm about ready to go to bed. And I say, okay, well, I'll go rotate the tires and I'll go fix the roof and I'll go, because he just takes forever, and like, what is he doing in there? And, but he's, he's real meticulous. And so, the other day, the other day, the other day, 2 or 3 months ago, I had a cancellation. Hardly ever have a cancellation. And I was like, Mike, I haven't cleaned your teeth in a year and 4 months. Get your rear in the chair. I bet it's going to be bad. And literally, you guys, he had nothing to clean off. Nothing. I could not make his gums bleed. I'm poking. I'm doing everything. I could not make his gums bleed. And I'm like, does this hurt? Does this hurt? No, dentists, we love to do that. We say we don't, but we love it. And anyway, I'm like, what are you doing? How are you using, what's your oral hygiene routine? And he's like, well, I don't like to oil pull. So I'm putting some drops of Nigella sativa in my hand, and I'm dipping my brush pick in it. And then I'm getting in there and, scrubbing and putting that oil. Can you hear it squeaking?
Yep.
Yeah. You want it to squeak. I'm putting that oil up in there between. So now that's the Mike method. You all are the first ones to hear about the Mike method. It's simpler. It's simpler. And it really, really works. So hopefully it will work for you all, because
Okay. So
I
have not a black seed oil, but this was like back, I think before I knew you, we found that John had porphyromonas in his mouth. And one of the ways we could tell, so porphyromonas makes a black pigment.
Mm-hmm.
And we would see this sort of grayish spots in the sink from the porphyromonas. But I started, thinking about different oils, and I had him use thyme oil, which, it's a little bit spicy, but, that was before we met you and got the pick idea. But we, basically he took a Q-tip and, pushed up in around the edges of, all of his gums and stuff. And I think when we did the bristle, he had some other stuff, but he didn't have porphyromonas anymore. So I'm wondering if, thyme oil might also, I don't know if it has thymoquinone in it, but it might.
Well, I think there's a lot out there that might be effective. I believe God's given us everything we need for life and godliness, and we just have to figure out what it is and probably not overuse it. Like oregano oil is very effective. Peppermint is very effective for different, oral maladies. So that's the thing now, though, that we can test. We can do like the bristle test before and after, and test and see what works for you. Everything doesn't. Now, I've talked about the bristle test a lot on different programs. I like the bristle test. I think it's kind of hard to read, and I've talked to the bristle people about that. They've been on the podcast. Since it's a shotgun genomics test, you just get so much information that it's hard to tell. In clinic, I use the oral DNA MyPeriopath that tests for 11 different pathogens. And Dr. McGlennon, who's the main biochemist there, and I have been talking actually this week, to have him drop a bacteria that they look for. They look for one called AA that's got a name like, 49 letters. And I practice saying it, but I still can't say it because I'm from Oklahoma and it's just not in our vocabulary. But then to add FNA, to add that subspecies of Fusobacterium nucleatum animalius, because some tests are starting to look at that, and that's a lot more useful
than the other.
Yeah.
Okay, let's let Sharon ask her question. We have Maha and Paula have questions too. So Sharon, if you want to unmute yourself, you can ask your question.
Okay. Thank you. And thank you so much, Dr. Ozment, for coming tonight. feel so fortunate to be able to hear your presentation and ask you questions. And my question is this. I thought about this when you were mentioning the root canal and having the tooth pulled. I have developed a pocket in my mouth that I can feel there's something wrong with the gum. And I saw two dentists. One dentist said it was a 9. I should get a laser gingival procedure for treating it. Another dentist said it was a 6 and just do watchful waiting. After listening to the program, this program heard about ozonated water and the bristle lozenge, and I've been doing both for 3 weeks, but I'm not feeling like it's better. It's not really hurting, but it doesn't feel right. And I am using those wonderful picks that I heard you speak about once before, so I'm doing that.
Thank you so much for bringing that up.
Not better. I think it's near the tooth where I had the root canal.
no,
So you can't hear me? Are you able to hear me?
Yeah, we
Can you
Oh,
hear?
you're back.
Yeah, you're back.
Yeah.
It can,
Came
so
back.
it is near a tooth that had a root canal. And so I'm wondering if I need to see a biologic dentist to look at this problem, or just continue longer and maybe add the black seed oil and continue longer with the ozonated water and bristle, or, you know, what your thoughts are about treating pockets, if you have some holistic approaches that you recommend.
Yeah, thank you so much, Sharon, for bringing this up, because this is key and something I would have forgotten tonight. It is imperative that you find a dentist who has a 3D cone beam x-ray machine and who is very comfortable reading one. I mean, find somebody who is like, I'll do a cone beam and I'll read it for you and I'll tell you what's going on, because the technology now is incredible. They will be able to tell you what's going on around that tooth. I suspect it's coming from that root canal, if that root canal is next door, or if that's the tooth. If it is very dangerous for your health, very dangerous depending on where it is located. So our teeth are like, they're connected to different parts of the body, the circuitry of our body. So I consistently see people with a bad root canal, say in the upper posterior quadrant, have breast cancer. And I have thermograms, they bring me thermograms and we see it lit up where the root canal's failing, following the lymph node down straight to the breast tumor. Lower root canals are very related to colorectal cancer. Saw a 37-year-old a couple of weeks ago. She's had part of her colon resection. She's been through chemotherapy for colon cancer, and she's got 2 root canals that are directly tied to that area that have lesions, big as $50 on each one of them. I mean, just so connected. The key is a 3D.
Wow.
Sharon. So.
Well, I think, Sharon,
Yeah.
I think if I'm remembering, you had that root canal removed, didn't you?
No,
Okay.
no, it
thinking
was someone
somebody
else
else.
on the show
Okay.
that night that did.
Okay.
I'm inspired by that person who spoke about it. And if you know of a dentist that would have this device and have expertise, I'm in New York City. So if you know someone that you think I could go and see to discuss this problem, I appreciate it.
I would look on the Oral DNA website. There's a good directory there. I would also look on the biological dental website. I'm not a biological dentist, but I office with one. So we have a cone beam, and I do cone beam on everybody because of the things we find. I mean, I found a BB in a guy's head the other day. So yeah, crazy. But I think that's IAOMT, Sharon. I think it's IAOMT.com.
And that's the website.
That's the website for biological dentistry. And they would be very good at showing you. I mean, it's not subjective. It's objective. We see it. We can follow it. People feel better. Oh my goodness. The miracle stories I see of getting infected root canals out. I'm not against all root canals, but once they're a root canal is a tooth on probation. Think about a taxidermied body part. That's what it is. We take the nerve out. We take the lymph out, we take the blood vessels, everything out, and then we fill it with an inert material. So it's kind of like in the garden where the plant that's kind of dead is where all the bugs want to go. That's the same way with a root canal. So you have to watch them closely if you have one.
I mean, I've been having the worst Candida infections. I'm wondering if it's connected to that, if the root canal problem has increased the risk of fungal overgrowth too. I don't know if you ever saw that, but
Yes, these oral pathogens, they impact your immune system. They sequester your immune system because it's like the army has to be there trying to keep this infection down. So when you get rid of an oral infection, then your body's more free to solve other problems. And it's like a chronic drip of interleukin 6, TNF alpha. It's a reason for an insidious reason for high HSCRP. There's a bidirectional relationship between blood sugar and oral inflammation. And the thing that, if I could leave you all with one thing, it's even a little bleeding matters. I mean, any bleeding matters. And we ignore it. We ignore it. I ignored it for the first 20 years of my practice because I didn't realize, like those teeth are okay, right? Your teeth are okay. You look great. But now we know it's not about the teeth. Now we know that bleeding is a sign of a chronic inflammation from head to toe. And if your dentist says, oh, you have a little bleeding, no problem, see you in 6 months, find another dentist.
Okay, so before we go to the next question, Rose asked for a little bit of clarity on what's the ratio of coconut oil to black seed oil, and then we'll let Maha
I
unmute
would,
herself and ask
if
her
you all have
question.
seen my videos, I don't measure, but I would say a small spoon with about a teaspoon of coconut oil and do 3 drops of Nigella sativa. And, if you get 4, don't worry. If you get 5, don't worry. You're not going to, there's not a precise ratio. The key is the coconut oil is the carrier for the Nigella sativa, the black seed oil. So you don't want to rinse with straight black seed oil. Number one, it would cost a lot, and it would taste probably pretty strong. But hopefully that answers your question. Is that clear? So a little spoon. The thing about oil pulling is that just oil pull for as long as you can. When you read a lot of the literature, it's like 20 minutes and people feel like they're a loser if they don't do 20 minutes. But boy, at about 11 minutes, I'm gagging looking for the trash can. And 11 minutes is better than not doing it. So give yourself grace and know that, do it as long as you can. It's going to help you. It's really, and there's a lot of people that talk about the systemic benefits, but I think it's because it decreases oral inflammation, and that's why you get those systemic benefits.
Great. Okay, Maha, you want to unmute and ask your question?
Sure. Thank you for being here, Dr. Debbie, Martha, and friends. Always a pleasure to see you. So, Dr. Debbie, I heard you say today that inflammation could be caused by processed food, sugar, etc. And my question is dicey because I know you interviewed Dr. Stevens, who speaks of the glucose protocol. So I have been eating dextrose for 8 months now. And Dr. Stevens assures me that it's not going to ruin my teeth. But how do you reconcile the glucose protocol with dental hygiene and the effect that the dextrose may have on teeth? And I have another quick question after that, if I may.
Okay, Maha, that's a great question. Thank you for asking. Did I interrupt? I'm sorry if I interrupted you.
No, no, no,
yeah.
no, that's perfect. Go for it.
I'll let you come back with your next question. That is a great question, because that was a stunning interview, and lots of people have had incredible success with Dr. Stevens. The key there is that you have to brush your teeth thoroughly and clean your teeth with these brush picks. The thing about it, Maha, these processed foods, they
I don't do processed food.
Yeah, no, I know you don't. But that's where a lot of the research comes from for the change in the oral microbiome, because a lot of people just really don't do a thorough job of cleaning their teeth. So the key is to make sure you're cleaning your teeth. What have your results been? Like, how do you feel after being on the dextrose?
At first, all my symptoms disappeared within the first 6 weeks. I was like really amazed. Where I am now is a lot of the symptoms have come back, but what continues to be helpful is with the neurological help. You may hear a tremor in my voice. That's a neurological condition. My sleep has become much, much better than what it was. The stress level I have throughout the day is much lessened. And if I quit, because I would like to lose some of the 5 pounds I gained, if I quit the protocol, I immediately feel my nervous system getting crazy again. So for that reason, I'm continuing, and I do believe in it. And I'm glad you mentioned it, because you're the perfect person to ask that question. You're just like the perfect person. So I thank God for you and for Martha and for our friends that are so dedicated to bringing health. And I learned about Dr. Stevens through Martha. And my understanding is that she learned of him through you. So it's a beautiful world. And I know my friends have questions, so I'm going to move on to my next question. I do want to say that your interest in the mouth microbiome over the gut microbiome is part of all the Jewish mysticism that I've given my life to. So that is, the mouth is something that speaks to me as being a huge part of scriptures and of mysticism. But my other question is, provided I do the bristle test, would you give televisit to read it and advise me on it? Would it be possible to have a Zoom appointment with you for a session? Do you do that?
Yes, Maha. Thank you. Thank you for sharing that story. I mean, that interview with Dr. Stevens was kind of like weird to me. I mean, at first I was like, I don't want to give anybody any bad information. He's just such a sincere person. And I really appreciate you sharing that. I'm so happy that you've gotten some relief. Yes, I do telehealth visits. I think it sounds like what I would prefer for you is to do an oral DNA test. You can contact me. I think we would get more information for you, specifically because of these red complex bacteria that are more neurologically inflammatory, if that's okay. So I'm easy to find. I'm really easy to find.
Ma, I can send you her email and connect you so
Perfect.
you can reach out to her.
Thank you.
No, thank you. And I'm so glad you shared that. The, I so admire everyone I meet through Martha and Dr. Davis and just different doctors who are doing their best to try to feel better. You know, that's
Yes.
it. I mean, just trying to feel better, because I think you all know my story. I got diagnosed with chronic lymphocytic leukemia 4 years ago. And the standard of care for CLL is watch and wait. And of course, I don't believe in watch and wait. You know, just like with a root canal, for Sharon, I don't believe in watch and wait. Let's just watch it. What are we going to do? Watch it get worse? Watch it infect your big toe? No, we're not going to watch it. And so the last test I had, which was not the deep dive I had initially, but the last test I had was no evidence of disease. And I think that's, you know, testament to all the things we're all learning. And I'm, you know, we all just want to live knowing that these bodies need maintenance. And we want to figure out, we know we're wonderfully made, elegantly designed, but we want to know what our responsibility is. And so you all are just such an inspiration to me. Thank you so much.
Well, ditto at a big level. And just to clean my teeth, I do my own oral. I use olive oil, essential oil, and that's all I use on my teeth. And I always has those little things that you speak of next to me. So I do that too. But if I were adding the oil pulling with the black seed oil, would that be a cleaning regimen that is enough to, you know, to not suffer from the sugar addition?
Yeah, I think it'd be great. And in fact, when I discovered black seed oil, because I'm all about, you know, natural stuff. So I was at a medical conference and had told my husband, at the time this has been about 10 years ago. So I was like, you know, 56. And I said, I might have to drop some money on some skincare because, you know, I'm seeing some problems. And I happened to be sitting next to this in a lecture, next to this gentleman that had this big old bag of expensive skincare that was for sale at this conference. And so I said, what do you like about this skincare? And he said, nothing. He said, I'm a dermatologist in Pakistan, and they give me this trying to get me to sell it. He said, I said, well, what do you recommend? And he said, castor oil. Use castor oil on your skin. He said, that's your base. And then add from that. So then that kind of led to starting to see Nigella sativa on the, you know, on a lot of labels. So I did 3 podcasts on Nigella sativa. It's a very fascinating oil. It's good for a whole lot of things systemically. So yes, Maha, I think it's really worth your time to use it in addition to the other things you're doing. I like the taste. It's real earthy. Everybody wouldn't like it, but I don't think there's any side effects. I sure can't find any.
Okay.
Thank you.
Thank you.
Paula is next, but I'm going to tell a short story about black seeds. Because I have this friend, and I won't tell the whole story of connecting with him, but his father, so he grew up in Pakistan, and his father was an Ayurvedic doctor. And at the beginning of COVID, I was talking to him, and one of the things he said to do for John, but then when he had told me to do this for John before, and then when COVID started, he said, you need to take the black seeds. And he had me take like a teaspoon of the black seeds and soak them overnight and then just like shoot them down. And, you know, when I started looking at like what's in black seeds and all of that, I think it's probably got some antimicrobial properties for the bad guys in the gut too. So it might be something you want to think about is, you know, looking for black seed. I think it has another name that starts with a K. I'll look it up and send it out with the follow-up, but that might be something, you might want to research and look into yourself, is that, black seeds may also be beneficial for the gut. Okay, so we'll get to Paula. We've got 1, 2, 3, 4, 5 after that, and we'll try to keep the pace going.
Hi, everybody. I will be very quick. Just want to share my tooth experiences, if you let me.
Where'd you go?
I'm coming. I have to grab the things.
Oh.
Okay, the toothpaste that I use. Oops, I need to lower my hand so people can see. Is the xylitol. The main ingredient is xylitol, I believe. This is product of Now. It's my favorite toothpaste. Doesn't have anything bad in it and washes nicely.
It's made by Now Foods?
Yes.
Okay.
Yeah.
Is that Natural Grocers?
I buy this from Green Store. I call it Green Store. It's Sunspa.
Yeah.
Maybe in your neighborhood is called differently, but actually I ordered it online because I'm traveling, so I need to have it with me. So the toothpicks are probably the same that you're recommending. And if I'm not lazy, and I shouldn't be, but I am, I have a little bit of ozone
Yeah.
in this tube over here. So you put your toothpick and you do the job for a couple of seconds and you're good to go.
I
And
got
because
I got the ozonated oil from Debbie, actually, when we went to do a clean.
this is ozone mixed with some
Yeah.
oil, so it will stay somehow. So you can do magical stuff with it. And if you want and you need to use something, I haven't used it, all of it, but this is the Oral Care. So those two, you mix them for 4 puffs of one, 4 puffs. So the other one, you mix it for 30 seconds. And
So is that like the chlorine dioxide from Frontier?
Yes.
beats
Okay.
me.
Yeah. That's not the stabilized chlorine dioxide. I like that better. I like the 2-part system better.
You have to have the two.
Yeah.
To do
I-
the job.
I think it's Frontier Bioscience has a toothpaste that we did use for a while, and then they were out of stock for a while, and I haven't gone back, but I really liked it because my mouth felt so clean.
Oh
after-
yeah, very nice.
so you're squirting the two different ones together.
Yeah,
I liked
I
it.
kind of stopped using it, but I should go back
No,
probably.
I think it's good that you pulse it. I talked to Nathan Bryan about that. Are y'all familiar with Dr. Nathan Bryan? He's done a lot of research in the area of nitric oxide. And so I said, well, is this antimicrobial? And he said, yes. So don't use it every single day.
No. Yeah.
You might use it like if you're going to a big gathering and you might be exposed to something. But I used to recommend it all the time until I talked to him. I love it. I think it's fantastic. And I think it's
It is.
a part of the reason that we never got COVID. I mean,
Yeah.
Oh,
one of us, and we always used it if we were going, to
there we go.
be around
I
people.
actually had to use it during the COVID pandemic because they had to pull a tooth. So they gave me the ozone therapy, and that was also, of course, the Ryotari, from BioGaia, the one that you're chewing, the tablets. Unfortunately, I'm off right now at the moment, but BioGaia makes Ryotari for chewing.
Mhm,
And they're fantastic. They're my to go. If I don't have toothbrush or I'm traveling or whatever, just chew one tablet of Ryotari and you're good to go. And it's a different, oh boy, I'm off of this thing now. I don't have it. But it's a different strain from the one that I make the yogurt from.
Yeah.
The other BioGaia, that is Osfortis. The other one, the blue one, I call them by color. The color is blue, so the blue is for your teeth. And I'm pretty happy and no bleeding. And my gums used to bleed like there is no tomorrow. And every time it was worse than before. Now, like you said, Debbie, they are trying to make me bleed. They can cut my in between the teeth, but I will not. So yeah, that was
No,
what I wanted to share.
that's great. Oh.
Thank you.
Okay, Jen, you're next.
Hi everyone. Sorry, caught
Hi.
me making dinner. Good to see you all, and thanks for coming, Dr. Debbie. It's always so
Oh.
great to see you. I want to know. For people who don't know me, I'm a nutrition coach, and I happen to be working with 3 different dentists right now, and one of them recommends disclosing tablets. Like when I was a kid, I kind of remember these at the dentist's office. What do you? And then, so I did buy some on Amazon because they still sell them. And those poking instruments, the probe. I've been afraid to do it. I haven't done it yet. But what do you think of disclosing tablets as a gauge?
Well, oh, Jen, that's a great question. I think it's that red dye number terrible.
I know.
I
Well, these
don't
are purple, but yeah.
Yeah, I don't know. I mean, and it's so interesting that you brought that up because I don't know if there's an option. Surely there's a healthy option that's some kind of berry juice or something. But the red dye we used to use was terrible. I mean, it was like, the worst red dye. Now, I don't know what you mean by the probe you bought. What did you buy?
I'm sorry, I don't know the right tool. But
Is it a scaler? Is it something to clean off like tartar?
there's a kit you can buy on Amazon that non-professionals can buy, and it's like a little the thing where to try to provoke bleeding in the gums.
Like a scraper? Yeah, I think that's probably
Scraper that comes with a mirror. It comes with like a couple things.
Yeah, that probably is okay. I don't know about the red dye. It may be better, so I don't want to judge it.
No, it looks horrible. No, it's not good.
Yeah. Oh, yeah. It was horrible. It was just the ickiest stuff in the world. So it does a good job, but there might be an option. I'll kind of look around for an option.
I'd love if anyone knows if there's a safe. I figured it one time just to like check in and see how I'm doing. Another question I get all the time as a coach is, what about a probiotic option for, I think I think don't want to do antibiotics unless they're trying to, they have a goal to do that. But
thank you for bringing this up. Okay, tomorrow I'm interviewing for the podcast Michael Silik. He's one of the owners of Baja Gold Salt Company.
Oh, great.
And so because of that interview, I've been doing some research into salt water as a rinse. And because I recommend that for people all the time. I give them a bag of Baja, I give everybody a bag of Baja Gold. But what was so funny or interesting, not really funny, is that I found a research study where they compared natural salt water, naturally harvested sea salt water with chlorhexidine. Now, chlorhexidine is a dental antibiotic rinse that pretty much you're going to get if you go get a tooth out or get anything done. They're going to give you a prescription for chlorhexidine, and it kills everything. Because it kills everything, it will cause your tongue to get black. It'll cause stain on the teeth. That's because it's killing all the good bacteria. Kind of like overuse of peroxide, hydrogen peroxide. If you overuse it, it kills the good stuff, and you get black hairy tongue. I mean, that's what it's called. So therefore, probiotics are an excellent idea, and like the BioGaia is an excellent one. There's a lot of good oral probiotics now. Mike and I actually developed some about 15 years ago. We were just too early to the party, and we can't sell anything. But we had a really good one that people called their bad breath pills, and Zymogen made it for us. And because they restored the oral balance. I think nowadays, and we don't have ours anymore, but the oral balance, I think anything that you find with Lactobacillus reuteri, L. reuteri in it is going to be a good oral probiotic. BioGaia has a good one. Bristol Health has a good one. Start to be a lot of good ones out there now, but I think it's a super idea. Super idea. And you can kind of gauge if you put one in when you go to sleep and you just notice that when you wake up, you have a better taste in your mouth, you know, it's doing its job. But if you have, even if you just have salt water, that's a really good way, because the minerals, you know, a true sea salt has like, you know, around 90 minerals and micronutrients in it, and those feed the good bacteria. So it sort of acts as a probiotic, if that makes sense.
Oh, yeah, minerals and microbes, right, Martha?
Yeah.
Yeah.
Well, so that in the last month, actually, I make beet kvass. I talk about this all the time, and that's great for nitric oxide, the bacteria. So I also read a research paper years ago that was said, you know, when you brush your teeth in the morning, you're basically getting rid of those nitric oxide producing bacteria. And so I started, when I get up in the morning, first thing in the morning, I swish around some beet kvass, which is also made with sea salt. So I swish that around in my mouth before, you know, and wait a little while before I brush my teeth. And then I swish a little beet kvass in my mouth before I go to bed at night. So I don't know if that's a great idea or not, but that's what I do to try to support those nitric oxide oral bacteria.
And that Jen might be a natural disclosing tablet.
Well, I was just thinking about that, but
Yeah, beet
Would
juice.
it
So you may
just-
have figured it out.
Well, I mean, you know, you make it, it's mineral salt. It's a little bit of whey. It's, you know, your beets and distilled water. So like, it's almost like the saltwater mouthwash kind of.
great.
Okay. So it says Sea Cruise. I don't know if that's Cindy or I can't. Oh, you have to, yeah, there you go.
Hi, it's Cherise.
Oh,
Thank
sure.
you, Dr. Ozment and Martha. You have no idea how much I love you guys and love your content. It's just so helpful. But let me get to it. Okay, my husband did a bristle test. We got the results back. He did have a high amount of some of the bad ones. So he went back and had his teeth cleaned. Again, we haven't redone the bristle test, but I really didn't know how to attack this bad bacteria. So could we have an appointment with you? I picked up that maybe we should do the coconut oil and the black seed oil, do the dental picks and scrub, those things that you mentioned, but we need to have it tested again. And then you mentioned an antibiotic. Is that right? I wrote it down, metronidazole.
Metronidazole, yeah.
Well, not unless you know for sure. I would not do the metronidazole unless you know for sure that bacteria is colonized in the gut, unless you know for sure the Fusobacterium is high in the gut. I don't use that just if it's high orally. I pretty much am testing both. So one thing, I have a free course, free right now, on my website called Upstream Gut Health that might really help you. It would help you make some decisions. And in that course, you know, it is filmed right here. So, you know, you can imagine it's just very homespun. And it's before the wall was blue. The wall is blue now, you all, because this is the color of my granddaughter's eyes. She's 5 months old. And so I painted the wall the color of her eyes. So anyway, we filmed that course. It's got a lot of information in it about what we've talked about tonight that I think you all would enjoy, and it's free. It's just 13 little short segments, and I demo up close, how to use the brush picks and some things. So then I'm accessible if you need me after that. Absolutely. Send me an email or something.
I'll put a link in the. I'll put a link on the Facebook group and also in the follow-up notification for the video recording tonight. And I'll put a link to your page.
If your husband has any gut problems, then it would be better to have a oral DNA test and a GI map. The GI map specifically looks for Fusobacterium, the oral bacteria, to see if it's colonized in the gut. So that would determine whether an antibiotic would be necessary. If we don't know if it's in the gut, I just don't want to overuse antibiotics. I'm so careful. I overused them for 20 years. I'm trying to
make up for
lost time. Yeah, when I didn't know.
Yes, I cringed at the thought of that. Okay, so real quick, one other thing. So I have a root canal that is about 50 years old. I dove into a swimming pool and I chipped my front tooth. I was a child and mother took me to the dentist, and I have a root canal there, and I have a crown and a veneer on top of it. That's the only way they could get it to match the others. It's the front center tooth. So I know I need to have a cone x-ray. My dentist can do that here. But I cringe at the thought, will they have to take that, like there's a post in there?
Not always. In like front root canals are less tricky because they have these straight ice cream cone shaped roots that they're a lot more predictable than the back teeth that have 3 or 4 roots, and they're all wound around each other. And so take heart, get it checked, for sure, get it checked. And if there's any kind of lesion around it, get it out, because it is impacting your health. But there may not be a lesion around it, especially since you were young, and it's a lot easier for a doctor to clean out that straight canal. So you're wise to get it checked, but don't fret yourself until you know what you're dealing with.
If it is bad, will they have to take that tooth and redo it? Because then all the other veneers won't match. Don't borrow trouble. Nowadays, there's so many things that we can do. Like I don't do restorative care anymore, but there's little laser lights we can do to match teeth. It's way simpler than it was when you were a little girl and had that happen. Okay.
So don't let your body get inflamed worrying about it.
Yeah.
All right. Yes. Thank you.
Stress is not good for you.
Exactly. Yeah.
Agreed.
Okay, Stephen.
Yeah, hi. First of all, first time here, recommended through Dr. Davis's group. And Martha, we actually have 2 of your products showing up tomorrow. So we're brand new. Question I had is, I'm dealing with a periodontist right now. You mentioned, and Jen kind of asked some of what I wanted to ask. But when I started looking at oral probiotics, it looks like a lot of them, you don't swallow them, right? You keep them in your mouth. They're either a lozenge or something you chew on. So you're trying to keep all that substance. Or you mentioned the salt water. Everything you're doing there, you're keeping it in the mouth, right?
Right. You're trying to. I'm getting the echo. Sorry. You're trying to push out you're trying to sort of crowd out, just in the mouth like you do in the gut, crowd out the bad bacteria and replace them with the good bacteria.
Okay, because we're doing the yogurt. We do the rotari, gastri, and subtilis yogurt. So I had a feeling that was the answer. But you already addressed the rest of it with Jen. So thank you very much.
Thank you.
Thank you. John Sansmore.
Hi, Dr. Debbie.
Hi.
2 quick questions. One is about the salivary glands. So I found out that I have clogged salivary glands, a mucocele in each cheek by the parotid accessory gland. And then I have more clogged salivary glands under my tongue where I recently had surgery for tongue tie release. So my question is, the first question, what do we do to heal the mucus layer and clear up the salivary glands?
Wow, John, that's a tough one. So you had a tongue tie release, and that caused that submandibular gland to clog?
No, there's a few little glands under my tongue that are clogged,
Uh-huh.
but there's also the two that are in my cheek, the parotid accessory glands, and
Uh-huh.
they've been clogged for 3 years or more. I just didn't know what it was until I started learning about salivary glands. So
Yeah.
I think there's a general condition, I don't know if it's the microbiome or what it is, where the mucous membrane is too thick or it's not letting the saliva pass through.
You know, John, I think you ought to find a good manual therapist who will don a pair of gloves. We have quite a few here, and I think they're everywhere. Don a pair of gloves and help massage that area. I really think that would be the simplest and most effective way to get those glands open. And then I think salt water would help you. I think, naturally hard sea salt. I like, and I should mention this, I like Baja Gold because it doesn't contain iron oxide. I mean, I'm 66 years old and don't need any more iron. But like the Himalayan pink salt is good too, and you might want that. It has a lot of good things, but it also has iron oxide, which is why it's pink. But the salt water would be good for you. And then a manual therapist, which is a physical therapist who's had some additional training. I saw my
manual therapist.
So I have a neuromuscular person. Not everybody's trained for this, but you can check around who she actually works. Not every time I go, but sometimes I will have her work, and she puts gloves on her fingers and goes in and works like all these muscles and all around my jaw and up in there. So you could find, it might just be like a neuromuscular therapist who can do oral work. And it's fantastic. Like when I started having that kind of work, any headache, remnant of any kind of headaches is totally gone.
Yeah. I think that's going to help you. That's where I would start, John.
Yeah, thank you.
I'll also look, John, I'll look for some things that thin mucus, and I'll try to come up with some ideas for you on that and let you know.
Yeah, thank you, Martha. Thank you, Dr. Debbie. Second question, what do the humic and fulvic minerals do for the oral microbiome? And should we swish, say, the beam minerals or the ion gut support around in our mouth also?
I don't know of any specific research, John, but I certainly don't think it can hurt. I mean, it just may be research that I haven't seen yet. Martha, I think you would have a better take on that than I do.
I haven't seen research on it in the mouth, but it makes sense to me because it's sort of the same thing with a mineral salt. You're providing, this complex mineral mix that's going to allow the good bacteria to have the micronutrients that they need. And we're all micronutrient depleted all over our body, and that would include our mouth and our oral bacteria. So, what I would say is it could get kind of expensive if you're, like I would say, if I was going to use the beam minerals, I would probably use the micro boost, which is more of the humic, and I would just put a little bit of it in, maybe in some salt water, and swish it around. Is that all, John?
Yeah, that's all. Thank you very much. Very helpful.
Great. And we got Debbie Burnish.
Hi, Deb.
Hi there. So remember I told you about my sister that thought I was a health nut, and now she has either severe or extreme diverticulitis that she was just diagnosed with, and they're thinking that she's going to have some surgery. But I also just remembered that she has several failed root canals. And so but she eats a terrible diet. I mean, highly processed, like hardly any fiber. So is it just the bad diet that's causing the diverticulitis, or is there an association with those failed root canals too that's affecting down there?
Well, it's never one thing. It's probably a combination of everything, but we do know that in terms of the circuitry of the body, if her root canals are on either tooth number 17, 18, 19, 30, 31, 32,
Mm-hmm.
and that's the area that's specifically associated with the colon, and I see it consistently. Okay. And so it certainly is a piece of it. I don't know that it's the whole thing, but it's probably a big contributor, Debbie, for sure.
Okay. All right. Thanks.
And you are a health nut. Be proud of that. That's a good thing.
Well, now I was just going to tell everybody I went to a family reunion on Sunday, and I found out that my brother, who's younger than I did, had a heart attack 3 weeks ago. And then my sister now has this, and she's older. She's like super negative on everything I say about eating healthy and eating organic. So now she's got severe diverticulitis. She's on a clear liquid diet right now. And so I'm looking like the rock star right now. So I feel pretty good about it.
You should. That's good.
Okay.
We have to ask for advice. You can't give unsolicited advice,
We have a question on the oral DNA. Is that the actual name of the test, or is there a company that does the oral DNA? Is there something specific about that?
The company's Access Genetics, and then they have a lot of testing. Oral DNA is one of their sectors. The test I usually use is called MyPeriopath, and it tests for those 11 bacteria, which includes Fusobacterium.
Okay, now I'm just trying to see if we have any other things in the chat that I think we've answered all of the burning questions that we have, and we don't have any more raised hands. So with that, we're pretty much right on time. Oh, Sharon's got another question. Okay,
Yes.
make it quick because we're at our 8 o'clock stop time. So
Very quick. You were talking about dry mouth before as one of the problems in the microbiome. Do you recommend using a chin strap when you sleep to make sure your mouth stays closed to prevent the dry mouth and the maybe excess acidity from dry mouth?
I think a chin strap or lip tape is a great thing. If you at all are a mouth breather, you betcha. Great idea. And then if you get a 3D that's recent technology, you can actually have your airway mapped and you find out the circumference and know if you have an airway problem. And then there are some doctors who can give you mouth exercises to help increase that airway. So there's a lot of natural ways to deal with that.
Great, thank you.
Thank you.
well, I think a lot of great questions, a lot of great information. And as always, I love having you. I love how you explain things, and you're just a delight. I think the way you share the information, and it's just so obvious how much you care about people and you want people to feel better and really be vital, like your Vitality Made Simple. So if you haven't been listening to Debbie's Vitality Made Simple, I I really highly recommend her podcast. Sometimes I have to do it in binges because I don't have time to listen to it all the time. But then I'll go, like, I'll have a weekend where I'm working in my garden and I might listen to 5 episodes in a row. So I highly recommend that. And I will include her upstream gut health in the follow-up, and just want to thank you so much for coming back and joining us and sharing your knowledge. Because this is how we all learn how to be healthy and help each other be healthier. And
thank you. It's a joy to be here. I just send you all a hug from Oklahoma, and just thanks for caring about your vitality. We need more people that feel good, look good, and want to have the best relationships possible.
love it.
Thanks to
All
both
the
of
best
you.
to you.
Good night, everybody.
Thank you.
Thank you.
Thank you.
Bye.
Turn my